Hi, social work students. Welcome to week 15 of social work history and policy. We're going to talk about three different topics this week. First of all, we're going to discuss the Social Security Act. Second, we're going to cover Chapter 8, which is all about disability. And finally, we're going to talk a little bit as mental health as a disability. So let's start out discussing Chapter 4 in your textbook. We have a couple of theories about that help us understand social problems. First of all, we have DeSwan in 1988, who talked about three different conditions for solutions to personal adversity. We've all gone through that, right? And I tell you guys all the time, the more personal adversity you have, the better social worker you will make because it gives you built-in empathy. It's an awesome thing. Yeah, when you look back on a rough life, you're going to say, "Wow, yeah, I've experienced stuff, so I will be able to handle clients who've gone through hell." Yep. So the three different conditions that DeSwan came up with is external effects. This is individual problem must affect others and others must recognize the effect. So an example of this might be others recognizing that sexual abuse is a horrific thing to happen to a child. And you know what's interesting is in some cultures still today, that's not considered that horrible. So that's not having an external effect on that individual, and that can be very confusing to a child who's been traumatized. The second is individual remedies. Coming up with a remedy, a coping mechanism. A lot of people who have problems with their weight were sexually abused as children. And so the coping mechanism becomes eating. And that's not really a great coping mechanism, is it? And that's an individual remedy that's not going to be enough to help that person. It might help them for short term. It will release endorphins in their brain, dopamine, which feels good, but in the long run, it's going to damage their health. So the third is uncertainty of moment and magnitude. So not really comprehending how bad the trauma was, and how little support and that people didn't come to the rescue and that kind of thing. The second theory is Chambers' approach, and this analysis has four different components. First, it has problem definition, defining exactly what the problem is, and then second, causal analysis. Third, identifying ideology and values, and fourth, consideration of winners and losers. So be familiar with those in chapter 4 of your textbook. Let's talk a little bit about the Social Security Act and how that came into play. Our nation's collective response includes many social problems, and there's three types of programs that are authorized by the Social Security Act. First of all, social insurance. Second, public assistance. And third, health and social services. So these programs all serve all Americans of all ages and income levels. So the Social Security Act isn't about income level. That is about being able to have assurance, public assistance, and services. The foundations of social insurance in Western Europe, the early social insurance schemes developed, they addressed the three different fears that were considered to be part of an industrial worker's life, okay? First of all was old age. Yeah, that can be fearful, can't it? Second is illness, and third is unemployment. We're going to definitely see some changes in policy. What an exciting time it is to be going into the field of social work and taking this class. I've really enjoyed how many of you have included COVID-19 as part of your written assignments, because it shows me that you are not only studying and learning, but you are adapting the principles that you're learning in this course into your mindset, which will only benefit your future professionalism as a social worker. So it's really exciting for me to see that. And it is very interesting time to be learning about policy, and we are going to see a whole lot of changes, I'm sure, as we move forward with COVID-19. we'll talk a little bit more about that as we move along today. So we had this example for us in Western Europe of what social insurance was. And so the United States came up with the Social Security Act in 1935. It was really only a skeleton of what the Social Security Act is that we know today. So it started out as just old age and survivors insurance. And we had, let's talk a little bit about the evolution of that old age and survivors insurance, or OASI, OC. There was a period of expanding coverage from 1936 to 1980, and then we had a period of retrenchment. Retrenchment means we didn't do anything. We retrenched, we held back. And that was about 1980 on, and the National Commission of Social Security Reform was put together in 1981. So, the way OASI operates is a compromise, okay? You know how I've often told many of you, especially those of you who are dealing with teenagers, that a big part of parenting or counseling teens is negotiating, right? We negotiate. So we compromise between true values. We want to protect, a lot of the times, and it's interesting, parents do this. Moms want to protect, dad wants to push, right? And so compromising between those two values, protecting the individual and pushing them out into the world so that they can succeed. And the way that is translated in OC is we compromise between adequacy and equity. All right. So adequacy is for the Social Security to provide sufficient income. Equity is providing a fair investment return. So read about this in chapter 4. Understand it. You'll need to understand the term pay-as-you-go, the program that where the most revenue pays current benefits. There's a few other insurance programs under the Social Security Act. We have the unemployment insurance, disability insurance, and medical insurance. We'll talk about those. First of all, let's start with medical insurance. The development of the national health insurance in Europe, all developed countries provide some form of national health insurance. Medical insurance in the United States was enacted in 1964, and this was when Medicare was introduced. The solvency issue. So massive reserves accumulated in trust funds. Nonetheless, all are under the pressure, especially the hospital insurance fund, and that is Medicare Part A. There are numerous alternatives to restore solvency, and public confidence has really eroded. And so it's something we deal with as social workers. Reforming Social Security includes privatization, and some approaches to solvency include increasing payroll tax, eliminating the wage gap, diversifying investments of trust fund assets, raising the age of eligibility, and benefit cuts. And so these are all theories that we will be able to reform the Social Security Act. There is a proposal, a reform proposal that came about for women in which they were given caregiver credits. And I think it's interesting to know, I know a lot of you have seen the movie On the Basis of Sex, which is the story of Ruth Ginsburg. It's really interesting how as a young lawyer, she saw that there was a lot of sexism going on with the legal community, and she wanted to change legislation. And she saw that a way to do this was by recognizing that there are men that need to be given caregiver credits. And so if she was able to demonstrate sexism from a man who was caregiving but not receiving the benefits because he was male, then that was what she was able to use to get her point across. And we have to be creative like that when we're fighting injustice out there. So for dual earner couples, earnings sharing is another item that has been targeted. So There are some means-tested programs under the Social Security Act. The three programs under the Act are means tested and not social insurance. And these programs are operated as federal state partnerships. Eligibility is based on income and assets. And there's a few different programs that you need to be familiar with. Some of you are already familiar with them. Perhaps you've received some of these benefits yourself or in your families. And if you have, you know what, that's great to recognize how these can really, help people just make it. The first is TANF, Temporary Assistance for Needy Families. And this came about in 1996. We formerly called it AFDC, but it is now called TANF. The second is Supplementary Security Income, or SSI. And the third is Medicaid, and this is medical care for the indigent. And I want to tell you a story about my personal experience. Some of you have probably heard this if you've listened to my lectures in Social Work 101, but I think it bears repeating because I think it's important to recognize that there are a lot of people out there that benefit from these programs that you wouldn't have any idea. I was raised in a fairly upper middle class family. My father was a physician. Now, both my parents had survived the Great Depression, and so they were kind of used to living a fairly low-key lifestyle. So I was raised on a farm. We ate a lot of what we grew. And I didn't know that I was any more privileged than any of my friends. And in some ways, I felt like I was less privileged because my parents had so many children. And, I grew up wearing hand-me-downs and that kind of thing. But my mother had impressed on me that welfare and things like food stamps were very unsavory, and that's something that you should never participate in. And she used some pretty ugly terms to describe people who took part in those types of government programs. And so I remember one time in particular, we were in the grocery store when I was probably 11 or 12 years old, and there was a woman in front of us in line who had a bottle of vodka and a loaf of bread, and she paid for the bread with food stamps. And my mom pointed that out to me and said, something about that. That's an example of the kind of people that use food stamps. Now, don't get me wrong, my mom was an amazing person, love her to death, but that was something that I think my parents felt like they had worked really hard to be where they were, and it wasn't fair. So fast forward many years, I was a young mommy. I had 4 children under the age of 5. Yeah, and my husband was in graduate school. We were living in a double-wide trailer in Reno, and I was running a daycare, and he was working construction on the weekends, and we weren't making it. And going to the grocery store was incredibly stressful, not just because I had 4 little kids, but it was hard to buy enough food to feed our family. My youngest little girl ended up in the hospital. She got a horrible case of croup. Her face turned bluish gray, and she was 2 at the time. And I just remember, after a week in the hospital, I'm sitting in the room, and they sent in the social worker, and the social worker said, "How do you tend to pay your bill? This is how much your bill is." And I just started crying. I just, burst into tears. And she's like, what? And I told her, I said, "Look, my husband's in graduate school. This is what we're doing. We don't have any money." And she's like, "Why aren't you on all of these government programs? You qualify for WIC, for Medicaid, for food stamps. I'm signing you up." She signed me up. She got us on Medicaid, which paid for my daughter's medical bills. And honestly, I was just so naive. I didn't understand. But what was really interesting, I went through all the training with WIC that you have to do, and then I paid back by doing the training myself to help other young moms later on. And I love that these programs are there for people to help them get on their feet when they are in a bad situation. Of course, right now with COVID-19, we've got government programs coming to the rescue all over the place, and people aren't thinking anything of it. But sometimes there is that stigma, and I think that's something that we all need to be aware of, especially when we're working with clients that are in need of help. go over all of these concepts in chapter 4 and become very familiar with them. And let's talk a little bit about chapter 8. This is the chapter on disability, and we're going to start out talking about just disability in general. Sorry, thirsty. And we're going to finish off today talking about mental health as a disability. So, first of all, let's define disability. There are 4 different approaches to what disability can be defined as. There's the medical model, the economic, the functional, and the ecological model. So let's start out talking about the medical model. So disability, according to the medical model, is impairment that results from loss or abnormality. So the medical model, of course, is something is wrong that we have to fix, and that's what defines disability. The economic model defines disability as a loss of productivity. So this person can't work because of this disability. That kind of helps this have a little more clout. It helps mental illness have a little more ground to stand on. Functional model, the inability to perform specific activities. And the ecological model, interaction between the person and the environment. So a disability ecologically might be ADHD. That individual has a hard time staying focused and interacting in their environment if their environment is school. Functional model, inability to perform specific activities. Does ADHD fit under that? Sometimes it might. Lost productivity, absolutely. Medical model, do we fix people with ADHD? Perhaps we empower them, and that would be a better approach. So, let's define disability for the Social Security disability insurance. So, disability means inability to engage in any substantial gainful activity by reason of any medically determinable physical or mental impairment, which can be expected to result in death or which has lasted or can be expected to last for a continuous period of not less than 12 months. That is from the Social Security Administration textbook that was published in 1999. And if you haven't yet watched your video for this week, it's really, really good. And it talks about a woman who had a mental health issue and ended up actually passing away because it was not recognized as a disability by the people who were trying to help her. So let's talk a little bit about the history of disability policies in the United States. Okay, so there were pensions for those who fought in the Civil War, and the disability policies supported income for these disabled veterans from the Civil War. In the 19th century, workers during the industrialization of the country, those who had become disabled in job-related injuries were able to be covered by disability policies. And one of the maladies, which has been fairly controversial, is addiction as a disability. And in 1974, it was recognized that there should be eligibility for benefits. In 1996, all of those benefits were eliminated. So pretty controversial topic for identifying as disabled if you have an addiction issue. Children need to be educated. There needs to be vocational training about disability. So in the last 3 decades of the 20th century, we saw the disability rights move forward a little bit more. We had the Architectural Barriers Act in 1968, and then the Fair Housing Act in 1968 as well. And then Section 504 of the Rehabilitation Act in 1973, Education for All Handicapped Children Act in 1975, and then the Zebley decision in 1990. And read and understand what those are all about in Chapter 8. So, the Disability Rights Era, Americans with Disabilities Act came about in 1990, and it had its origins in the National Council on Disability, and we shortened that to the acronym NCD. NCD held meetings with disability leaders in every state and issued recommendations that Congress should act forthwith to include persons with disabilities in the Civil Rights Act of 1964 and other civil and voting rights legislation and regulation. Pretty tricky to do, but the Olmstead decision helped that come about. The Supreme Court case ruling that persons with disabilities cannot be placed in institutions when not medically necessary. So get familiar with these concepts. The prevalence of disability, there was an increase in rates since 1970 due to an aging population and rising incidence among younger age groups. So there's going to be even more as our population continues to age. We've talked a little bit about that silver tsunami that's hitting because of the baby boomers that are aging. And so sometimes race has not, people of minority races have not been able to claim this disability. People living in poverty have had a harder time claiming disabilities. And the need for social workers is great in dealing with people who are living in poverty and people who are minorities and might be dealing with disabilities. Why do you think that is so? Perhaps people who are minority status have less opportunity for education, and maybe, so take for example a child on the autism spectrum who might have a minority background and has parents who aren't as educated, don't recognize the struggles that this child is dealing with. And so this child slips through the cracks unless a school social worker or another school counselor might recognize what's going on with the kid and help bring it to the parents' attention. People living in poverty who have less opportunity for education, the same might be the case. Let's talk a little bit about the prevalence of disability and how it rises with age. Okay, as we get older, we're more likely to have all kinds of problems, including disabilities, including both physical and mental health disabilities. So as a physician, my husband has often told me that the first thing he looks for in patients who are presented to him who have cancer is their age. And so, you're more likely to have cancer as you get older. The second thing is their smoking and drinking history, and not just smoking. That's pretty, most people recognize that smoking can be a precursor to cancer, but drinking also is. And so something just to be aware of. That prevalence of disability is going to rise with the elderly population. Some of the emerging issues in disability policy include community integration, helping communities recognize the need for these programs, Medicaid Community Attendant Services and Supports Act, or the MCA-SSA. This is also called the Community Choice Act, and this kind of helped people recognize that there needs to be recognition of disability policy in communities. Money follows the Person Rebalancing Demonstration Grant. Be familiar with that. So there are many mental health disorders and intellectual disabilities, musculoskeletal disorders such as arthritis, and we need to be aware of what the disabilities are that can receive compensation through these government programs. There's several different pieces of legislation that Chapter 8 discusses. go over those, be familiar with them. And I'm going to close our lecture today just by telling you a story about a personal experience that I had in dealing with mental health as a disability. And some of you are familiar with this story. I'm going to tell it again. I have permission from my good friend to share it with you. And I have a very, very dear friend who's a very professional woman. She has achieved in her field, she has achieved a lot of honors and a very, very brilliant woman. However, she was sexually assaulted as a little child, and to cope with that sexual assault, she developed dissociative identity disorder. Now, you're aware that dissociative identity disorder is, it used to be called multiple personality disorder, and it's a very tricky condition to deal with. And my friend went through some pretty stressful incidents in her life, and she ended up sending me a text and telling me she was going to take her own life. Okay, trained as a social worker, this is my best friend, one of my very best friends. And what do? She was in another city, several hours away. And so I called the police. I did what we are trained to do as social workers and did a wellness check on her. Long story short, she ended up in a mental hospital where she was treated horribly. And it's interesting, as I was watching the video that you all are watching this week, I thought of my friend, and I thought of what a horrible experience that she had, and how scary it is if you think about someone, and she's a professional woman, comes from a very professional family, and not a minority. And I thought, if someone like her can be treated this badly, what happens to the indigenous people? What happens to the indigents that come off the streets who have mental illness? They fall through the cracks. And so that's why as social workers, we need to be very, very aware when we're dealing with mental illness. We're dealing with individuals with disability. When I was practicing clinical social work, I had a couple of clients that were on disability for their mental health conditions, and it was what was empowering them to be able to get through the day, to be able to, have their rent covered, have the food stamps, and be able to get through. And so these programs are out there for a reason. Please be aware that as you look around, as you experience more of life, recognize that disability comes in many packages, and mental health definitely can be a disability. So that's my lecture for today. Please don't hesitate to call, text, or email if you have any questions, and stay safe and healthy.